Conway Medical Center in South Carolina has been a client and is a tremendous system, very forward thinking, very much looking at how to do things and willing to honestly give us a chance to prove out some of what we want to do. So have a retail pharmacy, outpatient pharmacy with them today. We are building out a specialty pharmacy with them as well. But out of the retail pharmacy, we started working with them looking at readmissions. They had a pretty significant readmission problem, unlike most hospitals in the US. And there are essentially a handful of categories that they actually get penalized by CMS for, as well as can be on some of their commercial agreements. And so the one that they asked us to work on with them was around diabetes. And so we started out by saying, hey, we have a technology that we can help wrap around these patients, but then services. So we start out with a pharmacist doing basically a full med rec and clinical review. We then will go through one of the big problems is a lot of times patients get medications discontinued or switched while they're in the hospital. That message never gets to that retail pharmacy. And if that retail pharmacy has that patient on autofill, they're calling and telling the patient they need to come and get the medication because they don't even know that the patient's not supposed to be on it anymore. So we'll go through and help make sure those medications get closed that they're not supposed to take. We then follow up, and the technology prompts all of this with a nurse at 7 days. So now the patient's back in their own home, they're comfortable, and they can actually, on a video call just like this, go through their medications and actually show them to the nurse and make the nurse make sure they know what they're for, that they're the right medications, and if they're not, to get rid of them. And then we actually added a third touch point further out. But that patient always knows that they can call that nurse at any time with any questions if they're not feeling well to make their first call that nurse. We've had over 500 patients graduate from the program and saw roughly a 65% reduction in readmissions within 30 days in that group. So really successful. I will tell you, Conway has been very excited about it and supportive. Actually talking about what other disease states we should expand into, but it is a very significant driver of success there.